Okay, imagine this. A new mother dog, just a few weeks after giving birth, suddenly starts having these terrifying muscle spasms, maybe even seizures.
Yeah, it sounds dramatic, but it's a real thing.
It really does. It's a condition called eclampsia.
Ah,
Thankfully, it's rare in humans, but it's definitely a serious concern for our dogs, especially those new moms.
absolutely.
So welcome to the deep dive. Today, we're focusing right in on eclampsia in postpartum dogs. That's the main event, though. We'll briefly touch on cats where it's much less common.
Right. It's primarily a canine issue we're discussing.
We've gathered info on the basics, the signs you need to watch for, what actually causes it, how vets figure it out, and crucially, what treatment looks like. Our aim today isn't just, a dry definition. We want to really unpack what's going on underneath and what it all means for you, the pet owner. So let's dive in.
Okay, so fundamentally what we're talking about here, the medical term is postparturient hypocalcemia.
Okay, that's a mouthful.
It is. But it just means dangerously low calcium levels in the blood after giving birth. Postparturient, meaning after birth. Hypocalcemia, meaning low calcium.
Simple enough when you break it down.
Yeah.
And when does this usually show up?
Typically, you'll see it develop, say, 1 to 4 weeks after the puppies arrive.
Okay.
But it's important to know it can sometimes pop up right at the very end of pregnancy, maybe even before birth, or sometimes even later into lactation.
So it's not strictly just the first few weeks then.
Usually, but not always. There's some variability there.
Got it. So the calcium drops. What's actually happening in the dog's body? Like, what's the direct effect of that low calcium?
Well, calcium is, it's absolutely critical for how nerves talk to muscles.
Right.
When that calcium level gets too low, it basically messes up the signals. Think of it like electrical static on the line.
Ah,
This leads to those uncontrolled muscle contractions, the twitching, the stiffness, potentially even full-blown seizures. We call those tonic-clonic contractions.
that sounds serious.
It's very serious. It can spiral quickly, causing a really high body temperature that's hyperthermia and even brain swelling, which is called cerebral edema. Life-threatening stuff.
Definitely paints a concerning picture. So who's most likely to get this? Are certain dogs more at risk?
Yeah, our main focus is definitely female dogs after they've had puppies, postpartum bitches.
Okay.
And interestingly, we see it much more often in the smaller toy breeds.
Oh, really? Like which ones?
Well, we'll get to specific breeds, but yeah, the little guys seem more prone. Also, it seems to happen more frequently with the dog's first litter.
First-time moms.
Exactly. And the timing, usually it's before about day 40 after birth. But like we said, occasionally even happens just before they deliver.
Okay, so you mentioned specific breeds. Are there ones that really stand out? If you have a small dog, should you be particularly worried?
Well, not worried, perhaps, but definitely aware. The information points to breeds like Chihuahuas, miniature pinchers, Shih Tzus,
Hmm.
miniature poodles, Mexican hairless dogs, Pomeranians. Those seem to have a higher risk documented.
So quite a few popular small breeds on that list.
There are, and just to circle back on cats, while it can happen, it's genuinely rare in cats.
Any idea why it's so much rarer in cats?
The exact reasons aren't totally clear. It might be that their calcium regulation during nursing is just, well, more efficient perhaps, or maybe because they often have smaller litters compared to some dogs. The overall calcium drain isn't quite as intense.
Interesting. Okay, so we know who's more susceptible. Now let's talk signs.
Okay.
What are those early warnings? What should someone watching their dog who's just had pups be looking out for?
Right. There are things you might notice just observing her at home. We call these historical findings, and then things a vet would find on examination.
Okay, what might you see at home first?
You might see subtle changes in her mothering. Maybe she seems kind of poor at it or just off. Restlessness is common, nervousness,
Okay.
panting even when it's not hot, maybe whining more than usual. Some dogs get GI upset too, like vomiting or diarrhea.
Anything else? Neurological signs, maybe?
Yes, you might notice things like ataxia, that's like being wobbly or uncoordinated, a stiff walk, maybe acting like her legs hurt,
Stiff gait, okay.
and sometimes, kind of oddly, facial itching. Facial pruritus, they might paw at their face or rub it on things.
Facial itching, that's an unusual one.
Yeah.
And these signs, they can get worse pretty fast, can't they?
Unfortunately, yes. Very quickly sometimes. These maybe milder early things can progress to more obvious muscle tremors, like visible shaking or twitching.
Right.
Then tetany, which is that really severe muscle stiffness we mentioned. And then potentially full convulsions or seizures.
And how fast are we talking?
Typically, the point where the dog might actually go down, unable to stand, we call that recumbency, and show extensor rigidity, where the limbs are stiff and straight out.
Yeah.
That often happens maybe 8 to 12 hours after those first, more subtle signs started.
Wow, less than half a day. That's a really short window.
It really is, which is why catching those early signs is so vital.
Absolutely. So if you do get the dog to the vet quickly, what would the vet be looking for during their physical exam?
Okay, so during the exam, a really high temperature hyperthermia, that's pretty common.
Makes sense with all the muscle activity.
Exactly. They'll likely be breathing very fast, a rapid respiratory rate. Their pupils might be dilated, big, and maybe react slowly to light. Sluggish pupillary light response, we call it.
Okay.
And then, of course, they might actually be showing the muscle tremors, the overall muscle rigidity, or even be actively seizing right there.
Okay, so we've got who's at risk, what signs to look for. Let's dig into the why. What's actually causing this calcium level to plummet, especially in these new moms who you'd think need it most?
Yeah, this is where it gets really interesting and honestly a bit counterintuitive in some ways.
How so?
Well, one of the major risk factors, believe it or not, is giving calcium supplements during the pregnancy.
Wait, giving extra calcium beforehand makes it worse. That seems backwards.
It does, right. You'd think more calcium would be good. But things like Tums, dairy products, or other supplements given while pregnant can actually interfere with her body's natural ability to ramp up its own calcium regulation when needed.
Huh. How does that work?
Basically, if the body is getting a constant high supply of calcium from the outside, its own internal system for pulling calcium from bones and absorbing it from the gut sort of gets lazy, for lack of a better word.
It downregulates its own production and mobilization.
Precisely.
Hmm.
So when the massive calcium demand of milk production suddenly kicks in after birth, the body isn't primed and ready to respond effectively.
Okay, that makes a weird kind of sense now. What else contributes?
An improper balance of calcium and phosphorus in the diet during pregnancy is another factor.
The ratio matters.
It does. Also, the mother having a low body weight relative to how big her litter is, poor nutrition overall during the pregnancy, it being her first litter, as we mentioned,
Right.
and just having a very large litter. Making milk for lots of puppies puts a huge drain on her calcium stores.
So it's like a perfect storm high demand meets a system that wasn't ready to supply.
That's a great way to put it. Yeah.
Okay, so let's say a dog comes in showing these signs. How does the vet team confirm it is eclampsia and not something else that might look similar?
Good question. They need to rule out other possibilities. That's called making a differential diagnosis.
Like what? What else could it be?
Well, hypoglycemia, low blood sugar, is one. Sometimes it can happen alongside eclampsia, but low blood sugar alone doesn't usually cause that severe muscle rigidity.
Okay.
Poisoning toxicosis is another. Did the dog eat something it shouldn't have? Usually the history helps differentiate that.
Right. Did it get into the antifreeze or something?
Exactly. And then you have primary neurological problems like epilepsy. But again, the signalment who the patient is, a postpartum female, and the blood work usually points away from that.
So those blood tests are key then,
Yeah.
specifically the calcium level.
Absolutely definitive. A blood test looking at total serum calcium, that's calcium in the liquid part of the blood, will typically be low. Less than 9 milligrams per deciliter in dogs, or less than 8 in cats.
And that's usually enough to diagnose it.
Generally, yes. While technically it's the ionized calcium that's active, measuring the total calcium is usually sufficient in this emergency setting.
Got it.
And like we touched on, low blood sugar might also show up on the panel. Interestingly, low magnesium hypomagnesemia has been seen in, well, nearly half the dogs in some reports, around 44%.
And does low magnesium make things worse?
It can, yeah. It seems to potentially promote or worsen the tetany, the muscle issues. Sometimes we also see high potassium levels, possibly due to metabolic changes from the muscle activity or breathing changes.
What about things like x-rays or ultrasounds? Do they help?
Not really for diagnosing the eclampsia itself, no. But an ECG, the heart trace, might show some changes.
Like what?
Maybe a prolonged QT interval, which is just a specific measurement on the readout. Or the heart rate could be slow, bradycardia, or fast, tachycardia. Even irregular beats sometimes.
Okay, so diagnosis is made primarily with the blood calcium. What happens next? This sounds like it needs immediate action.
It absolutely is an emergency. It needs inpatient care, hospitalization right away.
Okay.
Often, the first thing is tackling that high body temperature, the hyperthermia, if it's present. Cooling measures like cool water, fans. You have to be a bit careful with things like cold water enemas, but cooling is a priority.
And what about the puppies?
That's a crucial part. Ideally, the pups or kittens need to be removed from the mother, either given to a foster dam who can nurse them, or hand-raised with milk replacer.
Okay. What if that's not possible right away?
An alternative is to remove them for maybe 24 hours, or at least until the mother's calcium level is stable. During that time, the pups need supplemental feeding, and the mother's calcium needs constant checking with blood tests.
Right. And medication for the mother. What's the core treatment?
The absolute cornerstone is giving calcium intravenously, usually calcium gluconate, a 10% solution.
5E calcium.
Yes, given slowly, very carefully, typically over about 5 minutes or so. The dose is based on her weight, and it's vital to monitor her heart rate and ECG during the infusion.
Why is that?
Giving calcium too fast can actually cause serious heart rhythm problems, even cardiac arrest. So slow and steady is key.
Got it. What else?
Well, if she also has low blood sugar, that gets treated too, usually with IV glucose. If seizures aren't stopping with just the calcium, then a drug like diazepam, Valium is a common brand name, might be given IV to control the seizures.
Okay.
And if there's evidence of that brain swelling, cerebral edema, then specific treatments for that would be started as well.
And then what happens when she's stable enough to leave the hospital? Does she go home on medication?
Yes, typically she'll be discharged with oral calcium supplements, things like calcium carbonate or calcium gluconate given by mouth several times a day.
Like Tums you mentioned earlier.
Tums contain calcium carbonate, yes. A standard 500 milligram Tums tablet has about 200 milligrams of elemental calcium. The vet will prescribe the right dose, and this usually continues until the puppies are weaned off milk.
Makes sense.
And if low magnesium was found, magnesium supplements might be part of the take-home plan too. Also, a really important piece is advising the owner to start getting the puppies or kittens onto solid food, usually around 3 to 4 weeks old.
To reduce the milk demand on the mom.
Exactly. Lessen that calcium drain.
Are there any medications that should absolutely be avoided here? Things that could make it worse?
Yes, definitely. Corticosteroids, steroid anti-inflammatories like prednisone.
Why not use those?
Because they can actually interfere with calcium absorption from the gut and increase calcium loss through the kidneys. Exactly the opposite of what you want when calcium is already low, so they're contraindicated.
Okay, good to know. So after the immediate crisis is managed, what's the follow-up like?
Close monitoring is still key. Regular blood checks to make sure her calcium stays stable in the normal range. And then thinking about the future. If this dog were to have puppies again, it's absolutely critical not to give calcium supplements during the pregnancy.
Reinforcing that counterintuitive point again.
It's so important. Instead, focus on a really good quality, balanced diet during pregnancy with the correct calcium to phosphorus ratio, ideally around 1.1 or 1.2.1, and maybe avoid foods high in phytates like soybeans, which can hinder calcium absorption.
Okay. What about the next litter itself?
If she does have another litter, especially a large one, the vet might recommend starting supplemental feeding for the puppies earlier than usual to help reduce the burden on her.
Are there still risks or potential problems even if treatment is given?
Yes, unfortunately. Complications can still happen. Cerebral edema, the brain swelling, is a major concern.
And worse.
Tragically, yes, death is possible, especially if treatment is delayed or if the condition is extremely severe. And, practically speaking, if the puppies have to be hand-raised, that's a huge commitment and challenge for the owner.
Definitely. So what's the overall outlook? If dog gets eclampsia, is she likely to get it again?
Unfortunately, yes. There's a significantly increased risk of it happening again in future litters.
So what do you do then?
For a dog with a known history, the vet might plan for preventive calcium supplementation, but crucially, this would usually start after she gives birth, not during pregnancy.
Right, start it once the milk production really kicks in.
Exactly. But overall, if a dog gets prompt, appropriate veterinary care, the prognosis is generally good. It's really the delay in treatment that leads to the poorer outcomes.
Okay, so let's try and boil this all down. What are the absolute must-remember points for our listeners about eclampsia?
Okay, number 1, eclampsia is serious, potentially fatal, linked to low calcium after birth, mainly in dogs.
Got it. Serious, low-calcium postpartum dogs.
Number 2, recognizing those early signs, restlessness, panting, whining, stiffness, twitching is absolutely critical. Time is of the essence.
Early signs matter, don't wait.
Number 3, get veterinary help immediately. This is an emergency requiring professional treatment, especially IV calcium.
Vet ASAP.
Yeah.
Emergency.
And number 4, that really key point. Do not give calcium supplements during pregnancy, as it can actually increase the risk. Focus on a good balanced diet then and discuss any supplementation for afterbirth with your vet if there's a history.
Okay, that's super clear. Serious, watch for signs, vet immediately, and no calcium during pregnancy.
That sums it up pretty well.
It's definitely a lot to take in, but knowing these signs, the risks, and especially that point about calcium during pregnancy, hopefully, that empowers you, the listener, to be more informed and proactive if you have a dog having puppies.
Absolutely. And it really makes you think, doesn't it?
How so?
Well, considering this delicate nutritional balance during pregnancy and nursing, it makes you wonder what other things that we might think are helpful, other interventions, could potentially cause unintended harm.
That's a really interesting thought. It highlights just how complex these biological systems are.
Exactly, and why relying on professional veterinary advice tailored to the individual animal is just so important for keeping our pets healthy.